don't know what you feel like, Colleen. I just felt like slap, 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 slap
Yes.
right across my face.
I feel like it's just everybody's in turmoil right now.
Yes.
Everywhere,
Yeah.
wherever you stand on issues right now, it's exhausting emotionally and mentally. It really is. And I just think that this conversation is timely for what we're going through. And I feel for everybody, because I just think that's like, it's just like you said, the hits just keep on coming, and they're not good hits. They're not like, Motown greatest hits. They're just the hits.
Not at all. Yes.
Just keep coming. How do you know that they've really vetted the companies that they're investing in?
Yeah, that's a great question. Not only for menopause, right, but for all companies all along the women's health spectrum. Because one thing that I have seen and that studies have proven is that a lot of the products for women's health that are on the market today in this femtech space actually are not accurate. And so they're not providing the insights and the information that women think that they're getting. And we've seen that, for instance, like with period trackers, there have been studies that show, that the accuracy rate for like an ovulation tracker might be, the best accuracy rate might be 21% accurate. And, a substantial portion, like 95% of period tracking products on the market today have inaccuracies, or they're using technology that has been scientifically proven to not be an accurate indicator of the types of health conditions that they're trying to monitor. And so we do have that same risk in the menopause space. And just because a company garners a lot of interest and a lot of attention doesn't mean that it has necessarily been scientifically tested, scientifically proven, right? It also doesn't mean that there are scientists or medical professionals on the board or advising behind the creation of these products. There's actually a huge gap that I've seen in femtech products generally, where the tech company is creating the product, but they're doing so without any type of OBGYN or medical oversight or influence. And so consumers don't really have a way to know that. And, the burden is really on them to try to investigate these products. So back to your specific question, I would not take a celebrity's endorsement as, an indication that, yes, this product has been tested, it works, right? It's scientifically proven. I would look at the methodologies that the company and the products are using, and just kind of, seeing if those seem like they are scientifically valid, seeing if there have been any studies or clinical testing or trials done on those products. And then also talking, to healthcare providers, seeing if they think that that's a reliable method before just taking a celebrity's word on that. The other problem too is that a lot of times the apps and the wearables out there fall within a regulatory gray space when it comes to data protection as well. So a lot of consumers don't realize, but the Health Insurance Portability and Accountability Act, which is known as HIPAA, and that's really the federal framework for protection of health data privacy, it's actually not going to apply to most of those femtech apps and wearables that are out there today. So you could give that same health information to your doctor who's billing insurance, and they would be a covered entity under HIPAA and have to protect your data in accordance with those federal laws. But if you take that same exact data, you give it to a femtech company who is not subject to HIPAA, those same protections don't apply.
A lot of things came out saying, don't use your period tracker, or don't use, that tracker, because then people could find out if you're not having a period, if you're pregnant. Is that another thing that comes into play that could be a scary situation?
Exactly. And it's interesting, right? Because these data practices for these types of femtech companies have been going on for a long time. And this isn't to say, right, that a lot of femtech companies don't have really robust data practices, right? Protection, security of data. There are some really great companies out there. There's also femtech products, right, who, because of their nature, right, maybe they're a drug, or maybe they're a more, like an implantable device or something like that, that would have much heavier FDA regulatory scrutiny. But for those, very popular, tracking apps, health and wellness apps, wearables, those types of things that fall in that regulatory gray space, it's scary. And those data practices have been around, right? It's not new, but it's something that is now getting a lot of attention due to the potential reversal of Roe versus Wade. And that is an absolute possibility, right? There are several ways in which a law enforcement officer could get data from one of those femtech applications and then use that data to prosecute the woman for an illegal abortion, right, or intent to commit an abortion.